positive thinking and negative to virus. We are hearing a lot of conversation about the vaccine. It is important to us as ECHO to provide you the information so that you can make the best choice to help keep you and your family healthy and help protect all of us as a community. Ainani is also making the supporting role. Let me introduce our vibrant leader and ECHO Operation Director, Mr. Biju Chako, for official welcome. Thank you.
Hi, good evening, ladies and gentlemen. Uh, Welcome to our virtual meeting on COVID-19 vaccine Q&A with experts this evening. Very good evening to one and all present here. My name is Biju Chako. I would like to start by wishing you and your families my personal best by wishing you all a health and safety in these difficult times. Thank you, each and every one, for being here with us on this Valentine's Day evening. At the very outset, let me wish you all a very happy Valentine's Day, the ladies especially, and greetings to you all in the name of ECHO. We do our best when we do it together. So, this is a great first step in the right direction to force synergy between ECHO and Ainani, and for all of us in the Zoom platform today with one goal we all want to achieve: promote awareness and understanding about COVID-19 vaccine. A virus not visible to the naked eye has put the world on pause. It has put into question how and where to go from here. It is my pleasure to walk you through the awareness seminar. Today, we have two great panelists among us who will be joining us. One is I like to welcome Professor Joshi Jacob, joining us from Atlanta, Georgia. On behalf of ECHO and Ainani, we welcome you to our midst. Welcome, Dr. Joshi. And our second speaker for the evening, it's my pleasure to introduce Dr. Shyam Kumar he's joining us from Ontario, Canada. So I'd like to welcome him to our midst as well. So without further delay, I want to give you a very warm welcome once again to each and every one of you. For any questions, please feel free to text 516-996-4611. We look forward to hearing your questions and learning from the experts today. You can kindly or you can kindly raise your hand on the Zoom. I once again thank you for your participation. Once again, welcome everybody to this COVID-19 webinar today. So before I get to the program, the order of conduct today will be the first speaker will be speaking for 15 minutes, followed by a reflection on the vaccine from one of the young people who took it. And it will be followed by the second speaker who will be speaking again for 15 minutes, followed by another reflection. And then from there on, we move to the panelists the question and answer session will be moderated by our very own Dr. Thomas P. Matthew. I once again welcome my entire team in putting this event together along with Ainani. And once again, hearty welcome. So to pass the burden to thing, I introduce our PRO of the event, Dr. Binu Kopara, to introduce Professor Joshi Jacob.
Thank you, Biju. Good afternoon, my dear friends, and happy Valentine's Day. And before I introduce Dr. Jacob, I want to thank our Almighty God that He kept us safe and that we were able to come and give a talk like that. So thank you, Lord. So it's my pleasure and honor to introduce Dr. Joshi Jacob. Dr. Jacob received
This meeting is being recorded.
Dr. Jacob received his BS degree from University of Texas, Rio Grande Valley, and PhD in immunology from the University of Maryland School of Medicine in Baltimore. He then had 6-year postdoctoral work at MIT, and then he joined Emory University School of Medicine in Atlanta in 1999, where he is currently serving as a professor. His research focuses on antibody responses to viruses and designing novel drugs to influenza, dengue, and SARS coronavirus. If I try to read his CV, it will take me 2 days to complete, but I'm going to. He lives in Atlanta with his wife, 3 kids, and a dog named Charlie. And then he's currently working on his first movie screenplay. I want him to explain about that. Welcome, Dr. Jacob.
Thank you very much. Um, Let me get the slides up and running. It is such a great pleasure to be with you this afternoon. I'm very grateful for this opportunity. And what I'll do in the next about 12 minutes is just to give you a brief rundown about SARS coronavirus 2 and vaccines. And the question is, to be or not to be? Should we take it? Should we not take it? Should we wait it out? Is it just like a flu and we don't need to worry about it? We shall see at the end of this presentation. And whatever questions you have, feel free to ask. And you are not judged by the question that you ask, okay? And I may slip a little bit into Malayalam every so often, but the talk is going to be predominantly in English. All right, so if you looked at the incidence of SARS corona outbreak, laser point, okay. There are about 2.3 million global cases. There are 1 million deaths worldwide. And if you look at the red, you have hit almost all across the globe. And the question is, what causes it? Well, it is a virus. It is called SARS coronavirus 2. And this is a picture of the virus. And these red things that you see that is started on one virion, one particle, this is called a spike protein. And I will get into that very briefly as we get into vaccines. And this virus originated in a bat. And when viruses in other animals jump species, it causes like pandemics. And what happens is these things are called zoonoses. These viruses live peacefully in their natural host. It causes no disease, no overt disease in bats, for example. But when it jumps species, when it goes from a bat to a person, and when it goes from a natural to an unnatural host, and that's when you have this big scale diseases and pandemics. That's because the virus has not gotten in sync with the host that can live peacefully. So what the virus does is it will adapt by making mutations, and then with time, hopefully it'll get attenuated. And the reason why you have these viruses jumping from animals into humans, there are 3 reasons. One is urbanization. You cut down the forest and you build flats and residences and so forth. Number 2, there are predators that eat these things. And when they become extinct, there's nothing that kills it. So if you have snakes, you have mongoose that kills the snake. If you killed all the mongooses, then the snakes have no predator and they can just go on living. And the 3rd reason is exotic food choices. If you eat like bat soup and stuff like that, it's probably not, that it brings you in contact with these wild animals that normally you would not be in touch with. And the reason, and shown on this graph, each one of these little yellow things is one airplane, okay? There are over 100,000 flights in the air worldwide every day before the pandemic started. So all the yellow, these you see here on the world map are the flights that are in the air during a regular, midday, midweek. So that there are that many flights. So if I get an illness and I travel from Atlanta, it's 14 hours to Doha and then another 4 hours to Cochin, I have taken in less than 24 hours a disease that was localized in Atlanta to the Indian subcontinent. So that's how these things get spread, okay? Very good. And the problem with most diseases that you and I know, when you get it, you get sick. You cannot walk, you lie down and you rest. But the trouble with SARS coronavirus 2 or COVID-19, it's like an iceberg. In an iceberg, only a small portion is seen above the water. The majority of it is under the water and it's not visible, right? That's the reason why Titanic hits it and it goes down. And so in COVID, 80% of the folks with the illness are asymptomatic. You look at them and there is nothing wrong with them. and they walk around, they're not sick, they're just as fine. And so what happens then is that it is these asymptomatic patients that go on and unknowingly transmit this virus to an unsuspecting population. Okay? So the problem is just like an iceberg, 80% is invisible. 80% of the folks that get the virus are not symptomatic. Okay, all right. And so this is shown in this slide. If you look at it, 80% of the cases have very mild or no symptoms at all, and only 14% have severe symptoms, and 6% get critically ill. So but the problem is you do not know which in the cohort that is in the younger. This child has smallpox, and we fixed it by bringing in a vaccine. So in 1965, this was the caseload shown in yellow. And with time, when you start vaccinating, the number of cases goes. These are three examples. We will not go into it. This is diphtheria, polio, and measles. Once you bring in the vaccine, the caseload goes down to almost, very, very undetectable levels. Same with polio. You do not see people with poliomyelitis in the United States or India for that matter now. But when I was young, I have seen people who had polio. Measles is also a disease of the past, unless you live in Portland and then you are one of these anti-vaccine people, and then you will get this disease. Okay? So vaccines are good. So what are vaccines? So when you get infected naturally, like a chickenpox, you have lifelong immunity. Okay, that's because there's a system in your body that remembers the pathogens it has seen before. It can keep track of everything that it has seen. If you don't get infected, what you can do is you can actually vaccinate people, and you can induce protection. Okay, so vaccines express a small piece of the virus, or it can be even a killed virus. And what the vaccine does, you inject it in, it trains your immune system it tells you, okay, this is what this virus looks like, so you should fight it. So there are three phases. There's vaccination, there's a training period, and there's ready to combat. Okay, it's like joining the military. They don't just give you a gun and put you at the border saying, okay, go fight, because you don't know what to do with it. So there is a period of training. It's the same with the immunization. You get the shot, then you wait 1 month, you get your second shot, and then you wait 2 weeks, and now you are ready for combat. It's the same thing with the immune system. You vaccinate, you train your immune system, and you give it sufficient time, and now you have robust protection against the virus that you were vaccinated against. Okay, and so what are the different types of vaccines out there, right? So I will just talk about mainly the U.S. vaccines, because that's what we care about most. So there are many. It's like ice cream has many flavors. This vaccine comes in many flavors, and people are confused about, do I get this? Do I get that? I will just tell you what to get, since most of the listeners are in the United States. We have two choices, and they're both fine. And so the choices we have are, you have an RNA virus, where the piece of that spike protein I showed you in the first picture, the red spikes on top of the virus, you make that into an RNA, or you take that and you put it inside another viral vector, chimpanzee adenoviral vector, or you will kill the actual virus. This is what they do in India, the Covaxin, the Bharat Biotech does this. Or you make subunit vaccines. They take small bits of the protein and you inject them. So these are the different kinds of vaccines that are out there. And just to tell you, Moderna and Pfizer, these are the ones that are in the United States. These are RNA-encoded virus. I think these are the more superior ones. Oxford Seneca is fine, but they may have, if you ask me a question, I might tell you what I think could be the issue later on, not now. And you have the Sputnik is also, it's encoded in another adenoviral vector to give it to you, okay? And how effective are they? The mRNA vaccines are 95%. The ones that you and I get are 95% effective. The Sputnik vaccine is also 95% effective. The Oxford Seneca is 7. When I say whichever vaccine you get, you will not die from COVID if you get this vaccine, I guarantee you, okay? And usually what happens is they measure it as, when you say 95% protection, that means that if you're exposed to the virus, you will not get any overt disease at all. your immune system will contain it, and then you are going to be okay. All right. So how does this RNA vaccine work? You take a piece of the virus, and SARS coronavirus, and you encode it into an RNA, like you do. You code it in a lipid molecule and inject it into the people. And once it gets into your body, your immune system gets active, and you make antibodies and T cells that will attack this virus. And so the next time when you are encounter the actual virus, you're fully protected because you destroy this inbound virus. Okay, and when you get the vaccine, you'll get this card. Hang on tight to this because you might need it for travel in the near future. Okay, so now, should you take the vaccine? Absolutely. Is the vaccine protective? Yes. So what is the problem with taking the vaccine? There are many people who are opposed to it. 24% think I don't think it is safe. Let me tell you, this vaccine people say it's been rushed in a year, but they have undergone proper testing with stuff, and the studies are sufficiently powered, and they know that there might be some side effects, but when you compare that to what the COVID will do to you, it is a no-brainer. You just take the vaccine. They say there are side effects, no need to worry. They say, I do not believe COVID is dangerous for my health. It is dangerous. I'll show you a slide. I reject vaccination principle, or it's best for nature to take its course. Some diseases like chickenpox, you say, okay, I'll take the disease, but corona with COVID, you do not want to get naturally infected, and I'll tell you why that is, okay? And there is a lot of people who protest. You have seen it on the news. You go to Africa, you see them. They think Bill Gates is doing it. If you go to Washington, D.C., there are people who are protesting this. If you go to South America, they think that it's 5G is what's unleashing this virus. And in fact, if you go to UK, they think that the introduction of 5G has led to this virus outbreak, and this guy goes and he gets put in jail for 3 years because he set fire to one of these 5G towers. 5G has nothing to do with the virus. It was a bat virus that jumped species, and it is in humans. And it is not a lab engineered virus that the Chinese put in or anything like that. Okay. And this cartoon just tells you the misinformation that goes on. We will not get into it. And there was this video that passed on what's happened. All of us saw it, and that told us how, that the government engineered this virus. So this is just completely bogus, not true at all. So just plainly just ignore it. So why is COVID scary? This is the SARS coronavirus. It will, once it gets into it gets in because it sees this receptor called ACE2. And this ACE2 receptor is expressed in multiple cell types, not just the lungs. So once the virus gets into the lungs, it can go into the heart and cause you cardiac problems. It can go into the digestive system. It can cause kidney injury. It can go into your immune system and cause septic shock, disseminated intravascular coagulation. It can affect the brain, give you anxiety, fear, and anger. It can affect your neurological system and give you trouble. It can affect your reproductive system. It can cause impaired fertility in male and adverse pregnant outcomes in female. Not the vaccine, but the actual virus. Okay? But then you say, okay, that's the people who get really sick. What happens to the asymptomatic carriers, right? In fact, there are studies that show that even 50% of these asymptomatic folks that have no overt disease can have complications and long-term effects. If you look at this is a CT of a lung, even though they had no symptom, they have this classical ground glass lesions in their lung. And also, there are people who go on to develop asymptomatic people. 2 months passes, and now they have issues like they have heart problems, they have inflammation, and so forth. So the point I'm trying to make is this is not a disease that you say, okay, I will get it and I let nature run its course. You do not want to get this at all. So should I take a vaccine or should I get naturally infected? It's a no-brainer. Do not do this, okay? Just take the vaccine and be protected. And so there's one more issue and then I'm done. So viruses like measles, smallpox, chickenpox, The same virus that came when you and I were young are the same ones that are circulating now. It has not changed at all. But influenza, HIV, coronavirus, they change over time. And that is called variation, right? So if you asked a married woman would look back and tell you, you know, when I got married, my husband just adored me. Every time he saw me, he'd say, oh, you take my breath away. And then 10 years passed. And now I have 2 children. I have gray hair. He pays no attention to me. He looks at me and he says, oh, you suffocate me, right? And what has happened to him? He has undergone the same thing like the virus. There's a variation in his behavior that has happened. So he has changed over time. That's exactly what this virus. It started as one virus in Wuhan, China, and it changes by mutation in its genetic code. So this is the virus that started out in China. And if you see that it transmitted very little, small transmission, then it made one mutation at 614 position, it changed. And by doing that, all of a sudden, oh my goodness, it could produce a lot more viruses. And now the infectivity of this thing just went up. So this is the variant that actually moved out of China and spread across Europe. And this is the one that came to New York and so forth. So if you look at the incidence of this over time, just look at the colors. The blue is the original one. And with time, the variant just takes over, right? So these variants are much more infectious and they can actually take over. And I tell you this because there are these 3 variants that you and I should remember. The UK variant, you know about this, there's a Brazilian variant, South African variant. And the current vaccines will cover these 2 ones, this UK and the Brazilian variant. And the South African variant, it does not fully protect against, the current vaccines will not protect against this variant. So we need to make newer vaccines with a piece of the South African variant so that you can actually protect it. But having said that, even if you get infected with the South African variant, your protection is much, 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 much better if you got the mismatched vaccine than no vaccine at all. So if you say, well, you know, the variant is different, what if I get that? Well, you will fight it better. You will not get severe disease, even with the variant, even if you take the mismatched vaccination. So the question is, should you take the vaccine? Should you not take the vaccine? There's no question about it. So I've come to my last slide. So what do we need to do to conquer this in the short term? One, you prevent transmission. You wear masks, you socially distance, and you prevent intergenerational mingling. And when the vaccine comes, you take it. Whether it's Pfizer or Corona or Moderna, it doesn't matter. You take what is offered to you. They're actually almost identical, and I'll tell you what the differences are if you're interested. And so whatever is available to you, you will take it. And it is better to get vaccinate and not vaccinate at all. And with masks, what you have to do is, if you wear a mask, you have to wear it properly, right? And there is this really old Malayalam movie that you have seen where Sheelama tells Madhu that കടാപ്പുറത്ത് ഇങ്ങനെ പാട്ട് പാടി നടക്കുകയല്ല, എന്ത് ചെയ്യണം, മാസ്ക് കഴുത്തിലല്ല മുഖത്ത് വേണം കിട്ടാൻ. When you put it on, you got to cover your nose and your mouth. And with that, I end my talk, and I thank you for your time and attention. And I will answer all of your questions at the end.
Thank you, Professor Joshi. That was, I didn't know you were a little comedian there. That was a very thank you for sharing your knowledge on this. It was very insightful. Next up, I'd like to invite Jinsi Chako, who is the communication chair of Ainani, to share her reflection on the COVID vaccine. Are you able to unmute? Okay. Go ahead.
Can you hear me?
Yes, we can. Go ahead.
Great, thank you. Hi, everyone. I'm Jinsi Chako, and I'm the communication chair for Ainani, but at the same time, I'm also an employee of Northwell Health in New York. And as part of the health system, I was offered to take the vaccine along with the other employees of Northwell. Now, the difference between me and some of the other, especially frontline workers of Northwell, is that I work from home because I'm an informatics nurse. And most of the work I do is behind a computer screen. And so In the beginning of February last year, we were all of the informatics departments from Northwell were told to start working from home, and I have been 100% remote worker since then. So, when I was offered the vaccine, I had to think about whether or not it's a good idea for me to take it. What are the health risks of both contracting the virus at my age and also taking the vaccine? And I had to kind of weigh the risks and benefits of that and then make a decision for myself. So, one of the things I considered when I was making that decision was that I am a 100% remote worker. Would I really be exposing myself to the virus? And therefore, does the health risks of everything out there? There's a lot of rumors and there's a lot of information about whether or not we can trust the vaccine. Do I really want to take that risk? So when I was making this decision, I actually looked up information on the CDC website, the FDA website. I read up on how these vaccines are expected to work in a person's body, and then on top of that, I kind of interviewed a lot of the Northwell employees who were getting vaccinated. I talked to them. I asked them what kind of symptoms they had. Um, and then I evaluated what my risk would be going forward. And I felt because I have my mom who works also in the healthcare system and she's in the hospitals all the time, and that kind of exposes me to some degree. And I also volunteered because I have a nursing license. At any point, if the health system does need additional nurses, I could be deployed. Therefore, in that case, I might be at high risk. And also, just in general, I want to be able to travel this year. So I felt like if I do travel, I would be exposing myself. So for all these reasons, I felt it was better to be protected with a vaccine rather than be exposing myself to the actual disease. So eventually that won out, and I decided to get vaccinated. My mom also got vaccinated, and I monitored both of our symptoms. And um, I got vaccinated with the Pfizer vaccine, and the first dose I received, it was um, pretty much the symptoms, any side effects were non-existent. I had a little bit of pain at the site of the injection, and no fever, no chills, no headaches. Almost like a lot of people complained of being tired after the vaccine. I felt nothing after the first dose. And then 21 days later, I received the second dose. And when I got the second dose, I definitely had some symptoms where I had the pain at the site was a little bit more than the first time. I did get a mild increase in my temperature. I didn't really have a fever, but just a mild increase. I had some chills, um, and it lasted for maybe a day. And then I took the vaccine on a weekend, so I could rest up in case I got any side effects. And then after a day, I took a Tylenol for because I was feeling chills, and that one pill was all I needed to take, and I was completely normal. And now it has been 2 weeks since my second dose, and I am completely feeling fine. So those are my experience with taking the vaccine, and anybody who is my age is not really falling into the high risk category, but is afraid of the exposure you might be taking on upcoming, or if you're female and you're concerned about some of the rumors out there about reproductive health for women, I recommend that you read up on scientific information, not what is spread in social media, but more what is written by either researchers or scientists. And there's a lot of opinions out there. Read a few of them to really make a well-rounded opinion for yourself, and go with what the CDC and the World Health Organizations are recommending. That's what I did for myself, and I feel like I made a very sound judgment.
Thank you, Jinsi, for sharing your insights on the vaccine. That was really nice. Next upon, I like to, before we call upon the second speaker, I'd like to introduce Dr. Anna George, who is the president of INA, Indian Nurses Association of New York. INAN is partnering with ECHO for this event. Dr. George is a family nurse practitioner and assistant professor at Malloy College. Over to you, Dr. Anna George.
Thank you, Biju. First of all, I want to congratulate ECHO and its leaders, led by Dr. Thomas Matthew and others, for this great effort of bringing awareness to the public about COVID-19 vaccine. It is a very important topic, and ECHO has done very well. I am very happy as the president of INANI to let you know to partner with this great effort of bringing this important informed decision so the people can hear about COVID-19 vaccine and make informed decision. It is my honor to introduce to you our next speaker, Dr. Shyamkumar Devakumara Menon. Dr. Menon graduated from Calicut Medical College. He completed his internal medicine from Calicut Medical College and cardiology training from Sri Jitra Tirunal Institute of Medical Sciences and Technology. He has been the lecturer in cardiology at Calicut Medical College. He then moved to Canada. He had training in University of Hamilton, Canada. He has been a faculty of medicine at McMaster University, an associate professor and director of fellowship training program in cardiac electrophysiology at that university. Dr. Menon, we are very glad to have you amidst us. Please take it over.
Sorry, can you hear me? Thank you for the introduction, and I wish a very happy Valentine's Day for all of you. I will start sharing my screen now. Oh, how do I share my? Okay.
There's a share screen on your bottom.
Okay.
Next to participants.
So over the next 15 minutes, I'll try to convince you the need for taking COVID vaccines by answering some common questions which come across anyone who is skeptic about taking this vaccine. I had to take a disclaimer statement here. This is not my primary area of research or practice. My experience with COVID-19 is treating few patients with cardiac complications of SARS-CoV-2 infection. And also I have been following closely the development and development of this vaccine and rollout of the vaccine programs throughout the world. And also I had made some presentations for general public as well as for medical community in Kerala as well as in North America. And that's the main reason, Dr. Matthew has asked me to do this presentation. So as you all know, this COVID-19 SARS-CoV-2 infection globally, almost more than 108 million people are affected by COVID-19 and almost 2 million people are dead. And in the US alone, it can say around 27 million people are affected and around more than 400,000 people are dead because of this infection. And in the beginning of this pandemic, everyone was asking where is the vaccine, when the vaccine will come for people to use. But when the vaccine is available, when the vaccine is already ready for rollout, people are all skeptic to take it. And the more disheartening thing is to see even frontline health workers are hesitant to take it. But you need to keep in mind that it is normal to be skeptic because we are actually flooded with lots of information and quite a lot of misinformation. And the social media is actually weaponizing the people who are making the false information. So it is normal to feel skeptic about vaccines. So is it safe? Whether the vaccine program is rushed, whether if there is a political motive in this vaccine program, and is it going to affect this new technology? Is it going to affect my genome? Is it going to change my genetic um, material? And what's the role of vaccines at this point in time when new variants or new mutants are emerging? Whether should I wait for new modified vaccines to come up, and whether it's going to affect my fertility or whether it's going to cause infertility? These are some of the common questions encountered by any healthcare professional when we talk about vaccination programs. I try to answer these questions one by one and see, and if you have any more questions, we can discuss it during the discussion section. So, as you all know, we are in the middle of a pandemic. There are only three ways which we can actually escape, or this pandemic can come to an end. One is we all acquire infection and get what is called the herd immunity. That means more than 80% of the society or the population is immune, so that the virus find it difficult to replicate. But we know that we already paid enough price for adopting that approach, especially in some Scandinavian countries, and also from the US. The statistics show only 20% of people are actually showing immunity for this virus. But about 400,000 people are already dead. So if you wait for herd immunity to be achieved with natural infection, the society has to pay a big toll. The next and the most effective method is, if you have an effective vaccine and safe vaccine, that is the best way to get out of this pandemic and come back to normalcy. And the third possibility is, going through ongoing mutations, the virus becomes a much milder form, like a common cold. But we can't wait for that to happen. If you look into the timelines of vaccinations, the development of vaccines, you can actually see the minimum time for development from the conception of the idea till the rollout of the vaccine is close to 10 years. And there are some diseases, even though the research is ongoing, we don't have a highly successful or effective vaccine like HIV or malaria. The vaccine which produced in the shortest period of time is mumps vaccine, and that was almost 4 years. So the research and development of these vaccines will take quite long time. And once it is developed, it has to go through a rigorous process of safety checks. That means the clinical trials, means phase 1, phase 2, phase 3 trials. These are the process. This is the process by which we generate enough evidence to say that this vaccine is safe and effective. So the question is whether this vaccine, which is made available in less than 1 year time, is it safe and effective. So as you all know, this Operation Warp Speed actually included these vaccines which I am showing here, and Dr. Joshi has already mentioned about these vaccines. I'm not going to the details of this vaccine. So actually, what changed over this time, from olden days to now, is the science and technology. Because I'm sure, people who are growing up 20 or 30 years ago, they had some experience with all these gadgets, and now you can actually incorporate all of them into a smartphone. So what makes our species, the Homo sapiens species, special is what we call cumulative culture or cumulative cultural learning, because every human being is born into a wealth of knowledge which has been accumulated over time, and we are adding more and more to it. So we already have a launch pad from where we can start. So if you ask the question whether this process is rushed, The answer is yes and no. The most important thing we have to keep in mind is the crucial part of this process where the clinical testing and generation of evidence to prove that this vaccine is safe and effective has not been rushed. But what has been rushed? Whenever a pharma company or a vaccine manufacturer tries to bring up a new product, they are actually faced with so many obstacles because it's actually this is a process which takes many years and billions of dollars. And this is a place where, governments were actually chipped in and they actually took away quite a lot of um, red tape, red tapeism issues, and the orders were already in place. And once the vaccine is ready for production, the production facilities are already in full capacity to make them, and military services are called in for distribution. So supply chains are all intact. So all the process involved in the research development and supply and distribution were actually already oiled up and ready for to take off. And we already had the capacity, already have technology for this new vaccines or mRNA or genetic-based vaccines. This is not a new technology. This technology has been in place for many years and at least for the last 30 years. And we have a pandemic running and people are volunteering to be part of the clinical trial. So it's very easy to recruit people into this trial. And so 30,000 or more people were easily recruited over a few months' time, and they could complete the phase 3 trial in very short period of time. Only thing which is different in these vaccine trials is they actually combine this phase 2 and phase 3 trials. Phase 2 trial is actually mean it is actually they test in a very small group of people to make sure this is safe and effective. Then they move on to a larger phase 3 trial. They include thousands of people. So this phase 2 and phase 3 trials were in fact combined in this vaccine trial. So altogether, this is actually a triumph of science. And when the global global leaders in science and technology and scientists combine together, put their brains together, and then work for a single goal. And the end result was a very effective and safe vaccine. So there was alignment of all the incentives. That means it's an extraordinary time, so we needed extraordinary measures. So the pharma companies were nervous about their financial risks, which were taken care of by the political leadership. And this accelerated phase 3 trials because we have a running pandemic, so there is no problem in getting patients to be enrolled in the trial. There were people volunteering to enroll in the trial, so they could actually finish all the trials, generate evidence. And one thing we have to reiterate is there was no compromise on the scientific rigor or the process of generating evidence to make sure this is a safe and effective vaccine. The trial designs were not compromised. The quality of trial designs were all under scrutiny of multiple scientific bodies. So we are left. The end product is a remarkably safe and effective vaccine. So in summary, this picture actually summarizes the global collaboration and adequate funding can achieve in 21st century. Within few weeks of identification of this virus, the genetic codes are published. And once the genetic code is published, they could actually create a template for this vaccine. Within 1 week, this mRNA based on DNA vaccines were generated. And within about just more than 2 weeks, they could actually complete the trial. So this is actually the triumph of modern science and technology. So regarding this new technology, mRNA technology, even though we are using it for the first time in large scale now, this is not the first time it's being utilized. Previously, this has been used in other viral infections, but most of these trials are actually stalled because of lack of funding, and most of these diseases were actually not, you know, developed into a pandemic proportion. So the technology was there. What they were lacking is adequate funding. So when they got funding, they were all ready to put things together and create these vaccines. So the next question is, so it's very clear that this vaccine is very safe and very effective. So the next question is, especially younger people may say, this is just like another flu, but that's not true. If you look into the middle, the picture in the middle here, the flu is in this blue graph, and SARS-CoV-2 infection is in the red graph. So you can actually see the, the fatality rate of infection and infectious rates are way higher than seasonal flu. At the same time, you can actually see the case fatality rate actually goes up with age. For a younger person, it may be in the range of 1 per 1,000, but as we actually go to the higher elderly people, it's actually much higher. And like Dr. Joshi pointed out, it's not a condition which just affects your lungs or comes as in common cold. It can affect multiple organs in the body directly and indirectly. And also, we see that around 20% of people, what we call the long haulers, they come back after hospital discharge, and they actually, this lingers on and cause a kind of a chronic COVID-19 syndrome, post-COVID syndrome. So we don't really know what are the long-term effects of this relatively new disease. So we cannot write it out as this is just another flu. I don't mind having it. I'm having an immunity through the infection. So next question is, so is it, I'm a young person, is it better I get a mild infection because the case fatality rate of this infection is very low in a younger person. So why should I get the infection and get the immunity like that? So again, it's not a good idea. Why? Because even if you contract the infection, you don't know which subset you're going to fall in. If you are an unfortunate person, you fall into the less than 1% population where you get a severe infection, it can go really bad. And you can be a carrier, and you can actually transmit it to your loved ones. And if they are elderly, things may not end up really, really well. And it's proven now that, if you get vaccinated, even if you get infected, your viral load will be very low. The chance of you transmitting the disease is very low. So it's not a good idea to wait for the infection to happen and hoping that's going to be very mild for me, and then get naturally immune to that infection. Another thing is the indirect effect of this infection. When the hospital system is kind of overwhelmed with this disease, you are going to have all the other diseases or other management, the other conditions are going to be secondary. If you are diagnosed with a heart disease, heart condition, or diagnosed with a new cancer, or if you break your bone, if you make in an accident, your treatment may be delayed, or you may not get adequate attention. So vaccines are the best way to come out of this pandemic and get back to normalcy. So the next argument is, okay, why should I get because immunity? If I get immune through infection, is it always a better option? Probably you heard about young children being sent for rubella parties to get infected when they are, especially female children, they attend rubella parties to get infected. It's a mild infection, so before they reach their reproductive age, they are immune. So also chickenpox, you may get infected. If you are young, the complications are very low. You get your immunity, but it's not a good idea. Why? Immunogenicity trials have consistently shown that the immune response which is developed by mRNA vaccines are always superior and robust to a wild virus infection. And that is the main reason, especially we talk about this South African virus, which can reinfect those who already got infection. But a serious reinfection with vaccines are so rare, even in South African variant. The data we have is from the Johnson and Johnson vaccine and Novavax, even though they don't protect to 100%, the protection is as low as 50 or 60%. They don't get a severe infection, and it's uh, it's definitely better to have an immunity through this mRNA vaccines than infection. And I'll come to the reason behind that hypothesis. So if you look into immune system, I'll very briefly mention what we are trying to achieve by immunization is what we call this adaptive immune system that is specific to that infection. We have another part of the immune system is called innate immune system, which is kind of a general approach. Whatever infection comes in, this is the thing which actually steps in first, which include multiple components. And one component of this innate immune system is cytokines and interferons. And probably you are aware of the cytokine storm, which happens after a natural infection, which is because of the overactive innate immune system. So when you are inoculating somebody with this mRNA vaccine, you're actually giving the pure viral antigen, and it actually creates a much robust and better immune response. It won't affect the other parts of the immune system, and while wild virus infection has been shown to interfere with the other part of the immune system, especially in males, it has been shown to reduce the production of interferons, and in that way, it actually the immunity mounted by the natural infection is inferior to the one which is actually produced by this mRNA vaccine. Do we have an evidence? Yes, we have an evidence. This actually from the first dose, this is a trial which, I mean, it's not a peer-reviewed one, but it's actually through the process. Hopefully this will be published soon. And this study has shown that this vaccine-induced immunity provides more robust and robust immune response compared to natural infection. And this is after the first dose of this mRNA vaccine. So the next argument may be that it could cause possible long-term side effects. So till date, almost 160, 170 million vaccinations have been done all over the world, and there are no major side effects or deaths or major issues reported from across the world. The question is, we have been treating infectious diseases with vaccines for many decades, and we haven't documented any long-term effects of vaccines. Almost all the adverse effects of vaccines actually manifest within the trial period. So even though the anti-vaxxers are falsely propagating false news about autism and all, they are all debunked, and there are no definite long-term side effects of vaccine. So what's the alternative of this? You get natural infection and you may fall into full recovery, well and good, but you may end up with organ failure. You may have a long hauler for COVID-19, or you may die from the infection. So it's actually a choice which one you want to take, whether get the infection and be uncertain about what's going to happen, or take the vaccine and you know what's going to happen. Like Dr. Joshi pointed out earlier, one definitive long-term effect of vaccine is, yes, we have eradicated measles and we are on the verge of eradication of polio. So that's essentially the long-term effects of vaccines. Then mRNA may not be safe for people with autoimmune disease. That's partially true. We don't have enough data to show that mRNA vaccines, because we haven't tried mRNA vaccines in people with autoimmune disease, and this is the first time it's being introduced and tried for in this large scale. But scientifically, there is no basis for this sort of assumption, because mRNAs are destroyed immediately after it has been transcribed into proteins or the antigens, and they won't stay inside the body, or they won't attach to our own genetic code, so that it will be producing this antigens continuously. So again, we need to weigh the benefits versus risks, and then take an informed decision about getting the vaccine or getting the disease. So another concern people are worried about is whether mRNA can get back into the nucleus of our cells and then integrate into the genome, our own genome. That is the big no, because mRNA cannot enter into the nucleus because the nucleus is actually surrounded by a membrane which is actually not permeable, or mRNA cannot enter into the uh, nucleus and then attach the genome. In laboratories, if you want actually this mRNA material to get back into the nucleus, you need to perforate the nuclear membrane by giving a shock. That process is called electroporation. So lab studies, there are lab studies where we actually want the mRNA to get into the nucleus, and you have to apply this electric shock, a shock to perforate the nucleolar membrane, then only it can enter the cell. So in a normal cell, once mRNA is inside the cell, it is actually read by the ribosome. It creates the antigen, then this mRNA is destroyed. So it won't actually stay inside the cell, or it won't enter the nucleus. So that concern is actually is of no scientific basis. So this is actually the effect of vaccination in the United States and United Kingdom. You can actually see whatever mutant is circulating there. You can actually see the prevalence, the incidence of disease after starting vaccination. You can actually see the steep reduction. Of course, I'm not underplaying the other non-pharmacological interventions like masking and social distancing. So definitely, this is a very powerful way we can come out of the vaccine. So whether vaccine can cause infertility is another concern. This this concern or this question or this uh, problem was actually brought into discussion by a couple of people who found this spike protein antigen has some similarity with a protein called syncytin 1. This syncytin 1 protein is actually necessary for the development of placenta. So they argue that if you mount an antibody response against spike protein, that may actually prevent placental development, and the patient, they cannot become pregnant again. But that's actually without any uh, uh, scientific basis, because there are only five and amino acids which are in common, or the syncytin 1 or the protein necessary for the placental development and the spike protein, they share only five amino acids. There are hundreds and thousands of proteins in our body. The best example is hemoglobin. It actually shares more proteins or more amino acids than syncytin 1. Or the most abundant protein in our body is called collagen. It actually shares even more amino acid sequences compared to spike protein. So a mere sharing of five amino acids is not enough for the antibodies to attack those proteins and then cause problems in placental development, anemia, or infertility. So that's actually, this concern is also not a valid one. And like I mentioned, there are people who got pregnant after recovering from COVID infection, and even after vaccination, and people were included in the vaccination trials, and no adverse effects are reported in that any of these people. And also Moderna actually has data from animal studies showing it is actually safe in pregnancy. So vaccines are risky and there are side effects. So one thing you need to keep in mind is whatever we do in life, there are risks involved. More than 18 million doses of vaccines are distributed worldwide, and there were zero deaths or serious side effects reported, except uh, some anaphylaxis or severe allergic reactions reported. But almost all these allergic reactions are happening within the first 10 or 15 minutes of the inoculation. And you can actually see there were 4.7 per million is the incidence of severe allergic reaction for Pfizer and 2.5 for Moderna. So this is remarkably safe and effective vaccine. So they have only short-term mild side effects like injection site pain, mild fever, or some lymph node enlargement at the site of close to the site of infection. So again, we can actually see the downward trend in the all over the world where vaccination is being implemented. The best example is actually from Israel, which I'll come to in the next couple of slides. So the next thing which people can be confused about is if these vaccines are good enough for the mutants or variants. We need to understand that mutations or the variants happen when the virus is allowed to replicate. The faster you make people immune to this virus, then there is not enough host or not enough patients for this virus to replicate, and the mutants will not happen. The mutants happen when there are lots of unchecked virus multiplication is happening in the community. The best way to prevent development of mutants is immunizing people as fast as possible. So here, the spike protein has about 1273 amino acids. And you can actually see the number of mutations in each of these variants. This is a British variant, about 82 mutations. And this is the South African variant, has 40 mutations, and Brazilian has 18 mutations. So that means majority of the, if you imagine the spike protein as kind of a garland made of pearls, just by changing few of these pearls is not going to change the entire immunogenicity of the spike protein. There may be less effective, the antibody response may be less effective, but it will be it's going to be effective. But more than antibodies, the immune system is much more complex, and the immune response which is created by the vaccines are what we call polyclonal or multifaceted. So there are multiple aspects of this immune system attacking the virus. So just by showing that in the laboratory that antibody responses are 60% less, that doesn't mean these vaccines are less effective or not effective. Again, most important thing is they prevent severe infections, hospitalizations, and death. We have data from Novavax and J&J, and we can actually see the vaccinations actually prevented deaths and severe infections from COVID-19, including South African variants. So AstraZeneca trial was discontinued in South Africa, possibly a political kind of move, but many scientists actually said this is not a good idea because just what we see in the laboratory may not be what we see in the real life. And skip this. And again, when we talk about the vaccine statistics, the most important thing we have to know is about the risk of serious infections and death. And in Israel, more than 50% of people are vaccinated, and you can see the reduction in the new infections and hospitalizations and severe infections and deaths. And you can actually see the severe infections and deaths are actually close to zero after this mass vaccination in Israel. So this is again what I mentioned previously. Not only antibodies, we have other components of the immune system like T cells, memory T cells. They are all acting in concert and to prevent a serious infection. So we don't have to worry about mutations or whether the vaccine efficacy is supported or slower. We have to get vaccinated. Whichever vaccine available to you, have to get vaccinated. And then we can actually prevent this pandemic and come back to normalcy as soon as possible. There was one uncertain issue previously was whether this vaccination will prevent asymptomatic transmission. And we have this is the most recent data which was published yesterday. And it has shown that Pfizer, there is data from Pfizer vaccine and also data from Oxford vaccine. This will prevent asymptomatic transmission. So we are actually helping the community and we are actually executing our civic duty by taking this vaccine to prevent this pandemic. James. So I would like to stop at this point just by quoting a statement from the famous novel by Albert Camus, The Plague. It's actually, like I mentioned, it's our responsibility and it's our duty to the community to prevent this infection by taking this vaccine and doing our part along with the government, because curbing the pandemic is not the job of the government, but we all have to play a role here, and this is the best way we can help apart from adopting the public health measures. So whichever vaccine is available to you, you should get it. If there are any questions, I'll be happy to answer if I know the answer. Otherwise, we can discuss about it. Thank you.
Thank you, Dr. Shamk. It was a very knowledgeable conversation that you had here. Thank you for the opportunity that you took your time and effort to share your thoughts. Thank you. So next up, I'd like to introduce Archana, who is not new to ECHO. She has been playing a vital part. She's also the former education chair of INANI. So I'd like to call upon Archana Philip to share her reflections on the vaccine. Archana, are you there? Yes.
Am I on mute or can you guys?
No, yeah, we could hear you.
Okay, yeah, I was just waiting for the icon to disappear. All right, good evening, everyone. Thank you, ECHO and INANI, for giving me this platform and the ability to speak today about my experience with the COVID vaccine.
Could you please take the spot?
Okay.
Sorry.
It's okay. So a little bit of background about myself. I'm also an employee of Northwell Health. We're based in New York. So I work with the same health system that Jinsi also works for. I am a registered nurse, so I have a background in nursing, critical care, as well as outpatient. I did do my graduate studies in informatics, so currently I work in the information technology world of healthcare within Northwell. So for me, since last year, I want to say February, I also started working from home full time. So I don't have the patient care experience, or I'm not patient facing. So I do get to work from home. However, my husband is a clinical pharmacist. He specializes in oncology. So he does go to the hospital every day, and he does have exposure to patients as he rounds throughout the hospital with the physicians and the clinical team for patients who are under chemotherapy. So when my family and I decided to quarantine last year, it was basically myself, my husband, my two little children who are both under the age of 3, my parents who are elderly, and as well as my in-laws and just the immediate family. So we decided to quarantine just amongst ourselves, and obviously socially distance and not go out and have social gatherings. So considering all of those things and the people that I was around, my thought process around the vaccine was, hands down, I was comfortable getting it, and I was ready to hop on it whenever it was available. So I want to say back in late Jan, I was able to get the vaccine through my employers. And at that time, there was a lot of information. There was the first thing that I did to prepare myself was I had to kind of close all of the background noise that was out on social media, whether it was Facebook, Instagram, WhatsApp chats. I mean, information, it was just overload. It was abundance of information. And so I had to try to weed out the correct information from the false myths and the false information that was being passed around. So I tried to focus on the science, and I stayed away from people and their opinions. I focused on what was important to me and what was important to my family in the circle. The other thing, which was a key part that helped me make the right decisions, was I spoke to healthcare professionals who had firsthand knowledge of what was going on, including my husband, who was, like I said, hands-on, and being a pharmacist, he knew the science behind it. One of the other key things that helped me was the websites that was recommended by my employer in preparation for employees when they were receiving their vaccination. So this was, like CDC, the WHO, like Jinsi had mentioned before. And that was extremely helpful because any questions or concerns that was most commonly asked, those things were presented to you so that you were prepared for that vaccination. I just want to say that as a woman in my early 30s, and with the possibility of growing my family, I think it's normal for any woman in my age and my state to be concerned about the vaccine. But what was really important is, again, my conversations with my internist as well as my OBGYN. There's so much information. I would recommend anyone who's in my shoe, print out that information or bring it on your phone and share that with your internist, share it with your OB, and let them know, hey, this is the information that I'm reading. Is this true? Can you validate this for me? And I think that's really important. Get that expert opinion. And then the other thing that I would say is, at the end of the day, I'm just happy that I was able to play a part in getting the vaccination and doing my part for my community as well as for my family in fighting this pandemic. As far as the symptoms or side effects that I had with the first dose, I had soreness on the site of the injection site. And then I had some generalized lethargy. So I was tired for, I want to say, maybe half a day, and then I was fine. The other thing that I noticed was that I had an increase in appetite. I try to be healthy and I exercise and I eat well, but with the vaccination, what I found interesting was I was craving for like sweets and sugary things. So that was just something random that I did notice. Then the second dose, I had no side effects at all. I didn't have to take Tylenol, no fevers, no chills, no lethargy. I was playing around with my kids without any issues. So that's really what my experience was. Again, like I said, I wouldn't, and thank you for the information that you've been sharing about the fertility in your presentations, because it also gives me validation that, I made the right decision. So like I said, thank you to the speakers who also mentioned about the successful campaigns like smallpox and polio, and showing the graphs of how the vaccines caused the decrease in those incidents throughout the world. And I hope we can do the same for COVID. So even though I'm vaccinated, I'm still socially distancing, I'm wearing my mask, and I'm in this with all of you to fight this pandemic. So thank you, Echo, and thank you, Ainani, for the opportunity and the platform.
On the program, I'd like to invite none other than our own PRO, who is Binu Kopara. Binu Kopara actually took the vaccine way prior to it was actually FDA approved. So I would like to hear from Binu. He's been the national hero now all over Asianet News and so many other news channels in India. Binu, like you before, I just want my viewers to know that this program is live telecasted on Asianet and by Julia Digital on Facebook and YouTube. So let me introduce our PRO, Binu Kopara, to share a few thought process on the vaccine and the thing that you went through in short.
Good afternoon, everybody. Thank you, Dr. Jacob, Dr. Main, and Jinsi, and Archana for your thoughts as you all shared. My job is made very easy. I didn't have any WhatsApp or Facebook thing at that time last March. Why I went to the vaccine trial is just because I lost my friend, 47-year-old Biju David, and working at Pfizer and Merck. I'm a scientist. I worked 22 years at Merck and Pfizer. So I worked on more than 1,000 molecules. Only 4 came to market, and I worked on Citromax, Januvia, SGC just came out. So it takes 10 years to bring a molecule to market. Going after this, and I just told my wife that I'm going for this trial, and she was okay. First, she was scared. I was not worried about vaccine. I was worried about COVID, and I'm lucky to get into the trial. So I'm in the trial for 2 years. I got my 2 shots because I was on blinded study. They unblinded me. I took the shot actually. Shot. And then what I want to tell you today is, as Dr. Mann and Dr. Jacob already mentioned, not from the lab to bedside, it is not 1 year. You have to remember today, in all my speech, I want you to remember this lady. Her name is, this technology, this mRNA came from a woman. Her name is Dr. Kathleen Carrico. She even lost her job in the University of Pennsylvania. She left this research. Think about it. We will never have this vaccine now. She is nominated for Rosenthal Award, which is like a pre-runner for Nobel Prize. I got a message from her today that I invited her to come and talk. This mRNA vaccine was developed by this woman, her 30 years of work. So people say it is 9 months. It is not. It was 30 years of science that did, which paved the way to get our vaccine. Already Dr. Menon went on all this. But what also I want to tell you is that maybe after 5 years, we can think this technology will be a help for scientists and physicians to solve more than 6,000 genetic diseases. You can hear this every week. So please pray for this woman, Dr. Kathleen Carrico. It's not, I was a volunteer, doesn't matter. I just went get a shot, but you want to pray for this lady. Hopefully I can invite this person one day that she can come and give a talk. And, I want to thank all the doctors, nurses, respiratory therapists, every frontline worker. I didn't do anything. People call me hero, you took a risk. No, my job is R&D. You took a risk. So thank you, everybody. Thank you to ECHO, and a part of ECHO. I'm happy to be part of ECHO. And if you have any question about this technology, you can ask me. But remember Dr. Kathleen Carrico, who maybe God, there was a miracle hand behind her. So thank you very much.
Thank you, Binu. Thank you. That we didn't know about mRNA vaccine, the inventor of mRNA vaccine. She duly deserves the credit. Thank you very much for sharing that. Next up is our own we're going into the moderating session. I received a couple of questions. So the questions has been sent to Dr. Matthew. And I'd like to invite Dr. Matthew, our Executive Director of ECHO, who is the backbone of the organization. So I'd like to, without further delay, invite Dr. Matthew to introduce the panelists for the Q&A session. Dr. Matthew, over to you. Okay.
Good evening. Good evening. Thank you to all the presenters today. It was very concise and it was very to the point, including Jency and Binu. All the presenters were to the point. We are going into the last phase of this meeting. Basically, we have a few questions. We have one more speaker on the, to be on the moderating on the question and answer Q&A panel. That's none other than Dr. Solimol Kuruvilla. She's a vice director of Occupational Health Services, New York City Health and Hospital Services, Jacobi and North Central Bronx. I welcome Dr. Solimol Kuruvilla also. Professor Joshi Jacob and Dr. Shyam Menon will be answering the questions, most of them. So if you have any questions, you can text it to the number which has been shown on the screen, or you can raise your hand. Raised hands will be answered in the end. Now, I'm going from the questions from the ones which I have already received. This question goes to Dr. Joshi Jacob. The first question is, how long does the immunity last after a vaccination once we take it? And do we have to take it yearly?
So the short answer to your question, it's actually a very good question. The first thing to remember is the vaccine-induced immunity lasts longer than your natural infection immunity. That's good news, number one. And we know that the vaccine-induced immunity lasts for at least 8 months because it has only been that long that they have looked at. So any vaccine that lasts maybe a year or two, that's actually pretty good. And the question is, are you going to have new vaccinations? I think it's absolutely yes. I think when you look at hurricanes, when it is in the sea, it's like a category 5. And then it spins and spins, it makes landfall. And as it goes across the land, it loses speed. And then it becomes like a tropical depression and rain, and then it just kind of goes away. So what's going to happen to this virus, I think, is that it is going to mutate over time and make variants. And it will probably become a flu vaccine that you'll have to take, like a seasonal corona vaccine, until it mutates to a point where it can live in harmony with you and me. I have to remind you, 20% of your common cold is caused by coronavirus. There are 4 coronaviruses that can infect us all the time. So this could eventually become one like that. It's possible. So to answer your question, yes, vaccine-induced immunity lasts a long time, clearly more than 8 months. Does it last a lifetime? We do not know yet because we have not quite gotten to that time point yet. But what they do is they can actually plot it out, and then by the slope of this curve, they can actually calculate how long it would last.
Great, thank you. Thank you. The next question is to Dr. Shyam. Dr. Shyam, can you tell me any single person who should not get a vaccine at all, who should not get this COVID vaccine at all?
As of now, if you have a allergic reaction to one of the components of the vaccine, that may be the only contraindication. And also, if you received a monoclonal antibody as a treatment for, say, for any, maybe for COVID-19, or maybe for other conditions like rheumatoid arthritis, where monoclonal antibodies are given. The problem is, they suggest to wait at least 90 days after the monoclonal antibodies. Other than that, there are no contraindications for anyone to get this vaccine. The anaphylaxis, even though some people develop severe allergic reactions to some of the components of the vaccine, they are fairly easy to manage. So especially with mRNA vaccines, there shouldn't be anyone should not be getting the vaccine.
Question. The next question is again from the group. This question is to Dr. Solimol Kuruvilla. Can COVID-19 be passed from mother to child?
Yes, thank you for the question. I was just reading upon it very recent about a recent data. Towards the end of the pregnancy, if it is during the last trimester of the pregnancy, yes, there is a possibility that some of the antibodies could be passed on to the baby, and the child may be protected also.
Great, thank you. The next question goes to Dr. Joshi Jacob.
Not hear you.
കേട്ടില്ല.
The next question goes to Dr. Joshi Jacob. The question is, patients who are undergoing chemotherapy and dialysis after COVID-19 vaccine, how long do they have to wait to continue their treatment? Is there a wait period, or can they go ahead?
Actually, I do not know the answer to that. I think you should probably save that to the, probably ask Dr. Sham.
Dr. Shyam.
Because I don't know that.
Dr. Shyam.
No, because the only concern in immunosuppressed people who are undergoing treatment for cancer is, the amount of immunity triggered by the vaccine may be suboptimal compared to someone with a, otherwise normal immune system. So, but they will be protected by the vaccine, but it's always better than having the wild viral infection. It's going to be even more catastrophic. So they should be treated just like any other people, and there shouldn't be any problem in continuing their treatment. The only, like I initially said, if you treat them with any other antibodies, like a monoclonal antibody as a part of their treatment, that can actually suppress the immune system and it will reduce the efficiency of our immune system. So the recommendation is to wait for 90 days after an immunoglobulin treatment. But for cancer treatment and dialysis patients, they can just continue their treatment as usual, even after receiving the vaccine.
Thank you, Dr.
If I may add to that, well, by the way, thank you for having me. Now, if this folks who are immunocompromised are getting the vaccine while they're immunocompromised, there is no reason to repeat the dose once their immunocompetency is achieved.
The key thing is these are not live vaccines, and it is very safe for it's not going to cause any infection.
Dr. Joshi, how effective is this vaccine against the variants, the new UK and African variants? And along with that, which one is worse, UK variant or the African variant?
The South African variant would be worse than the UK variant. Both the Moderna and the Pfizer vaccines, there's a paper that just came out in Cell. It actually covers the B117 UK variant very well. Number two, and it does not cover the South African variant. It doesn't neutralize the South African variant very well. But I have to remind you, neutralization is a test that we do in the laboratory. There are many other tests, many other ways by which a virus is neutralized. You can do a shot through the heart and kill it. You can also bring somebody down with body shots, right? It's the same thing with these. So when you make this, when the variant comes, the vaccine cannot hit at its heart, but it can give it sufficient body shots that it slows it down so that the recipient does not get like disease or it doesn't transmit. The outcome is better. I am surprised that they stopped the trials in Africa. I mean, if you don't have an alternative, then what is, and to develop another mRNA vaccine would be, you could probably do it, but the point is, variations are going to see. These came about even before this immune pressure on the vaccine, on the virus to change. Now, when we vaccinate everybody, then the virus will continue to change, and we'll have to see. So every time a virus mutates, there has an opportunity cost. So there is a problem. If it can survive well, then that is the one that goes for. Most mutants will not survive. So we'll have to wait and see if we will have more vaccine escape variants that come up over time.
The next question, I have Gracie George raising the hand. If you can unmute and ask the question, Gracie George.
Gracie, unmute yourself. Yeah, go ahead, ask the question.
Go ahead.
Gracie George, go ahead, ask your question.
You can ask your question now.
Okay, Dr. Matthew, continue. I think she.
Okay, there is another question from Tara Shajan. Yes, go ahead.
Unmute.
Tara Shajan, you have to unmute yourself.
Host, no.
You did not raise your hand. Okay. So my next question is to Dr. Solimor Kuruvilla.
Doctor, I unmuted her.
Okay.
Her question was, she saw a patient today.
Yeah, she's there.
Yeah.
Okay, go ahead.
Hi, good evening. I'm Tara Shajan. I was the past president for the INANI and current treasurer for the NINA organization. I have a question. Like today, I just came back from the work and I joined in late, so I didn't hear the major part of the talk which went through. But I'm sure there will be an answer to this question. The question is, today we got a patient. This patient had coronavirus. She was infected in last January. No, sorry, in the March. And thereafter she tested negative. And recently, like I think when the vaccine was administered in the first phase, she got the vaccine. And today she came back after, I think, 8-9 weeks. She came back and she's tested positive. So the question was like, even she had the natural immunity, which she got it through her infection naturally, and she got the vaccine, but still she is tested positive. So what is the chances that the person might get reinfected even though having these two scenarios?
I think, who are you asking the question to? It's a free for all?
It's a free question.
All right, okay. Let me try to do it. So two things. Number one, there is a possibility that this patient may be somehow some level of immunocompromise that you don't know yet, right? Maybe she has a B cell anomaly. She can make IgG antibodies or something, okay? That's number one. Number two, even if you had natural infection, your immunity does not last more than 5 months. They already know that, because that's why when you do a convalescent plasma treatment, most donors drop off after like the 4-month time point because the level of neutralization just drops. Okay? So the reason why she got it, even though she was infected before, could be because she had passed the window of protection. But what's interesting with this scenario where she gets reinfected again after she gets the vaccine, I would have at least two things that I would work on. One, to make sure that she actually responded to the vaccine. She has antibodies against the virus. She should be, okay? Mm-hmm. Number one. And number two, you want to sequence this virus that she has to make sure that it is what we think it is, and it is not some kind of variant that has popped up. I'm in Glen Oaks or somewhere in New York that we do not know about, right? So the two things to test is test the patient for any immune deficiency. You just take a serum and do a tetanus antibody test just to see, does she still have all those? Is she like normal immunologically? Number two, I would sequence this virus. Other than that, you should ask the physicians what they think about it.
So just wanted to ask a question. What tests were done to make sure she was negative? Was it an RT-PCR? And what was done for diagnosing the reinfection? Because PCR can actually detect viral genome or viral RNA, even if it is a dead virus. So we need to make sure the tests they have done to diagnose negativity and subsequent infection, whether antigen test or RT-PCR. Do we have that data?
Yeah, she was tested with PCR in the month of this December, and she was negative. And then I think 8 weeks ago, following it, I think she took the vaccine. So after vaccine, now today she got readmitted, and when she admitted, when we just tested her, she was positive. She was admitted for for her another ailment, but for the routine COVID testing, they found that she is positive, but she's not symptomatic.
Yes, that's not at all, unusual, because the Pfizer trial actually showed, actually the Moderna trial, actually they did swaps between first and second injections, and there were actually uh, positive cases after the first dose of vaccine, but most of them, they don't develop the infection, and that's what the vaccines are supposed to do. You may get infected after the first dose, and now only after the second dose, after 10 days after, 2 weeks after the second dose, they consider the full vaccine effect is there. So it is possible they may get, they may contract the virus, but unlikely they will develop the disease.
But did she get 2 shots, right? She got 2 shots already, right? Yeah.
She got the 2 shots. The question was, she's not symptomatic, whether she needs to be quarantined or isolated from the other patients, whether she can infect others. That was a question which was in dilemma, and we were not sure of, because our CDC protocol is every day changing, and this is not yet been as sort of identified, or it's not been addressed so far. So that was a question which came up.
That data was actually, out in the press yesterday from Pfizer trials and also the Oxford vaccine trials, and they claim, these 2 vaccines actually will reduce asymptomatic transmission. But a reduction may not be meaning 0, but definitely that's less than having a wild infection in an unimmunized patient.
If you did you should probably do a quantitative PCR on the nasopharyngeal.
They're doing it. Yes, they're doing it
as well.
Yeah.
And it'll tell you what is the extent of RNA copies that she has. And then if it is high, you just quarantine her. It's very simple till she turns negative.
Okay, thank you.
Thank you. Thank you, Dr. Shyam and Dr. Joshi. The next question is for Dr. Solimol. Question is, what conditions of the lungs make you at risk for complications to COVID-19?
I'd say any inflammatory conditions that is already in the person can put that person in at risk. I believe it was a doctor, I don't know if it was Dr. Shyam or Dr. Jacob, who showed, it's not a one system, just a respiratory system that is involved in it. When COVID affects us, it is affecting pretty much all the systems, right? So it can be any system. What exactly in the respiratory system, the mucous membrane, starting with the mucous membrane, it can affect it. I think one of you can actually add to that.
So any long chronic lung conditions can cause problems with,
asthma, COPD, any lung problems will put those patients at risk. And by the way, Dr. Shyam, I'm also from Calicut Medical College, Science College of Nursing graduate.
See, the virus enters a cell by binding to a receptor. It's called ACE2, okay? So it's like doors on a house. Normally a house has 2 doors, one in the front, one in the back. Diabetes, if you have these chronic conditions, right, comorbidities, you have a house with like doors all over the place. It's very easy for the virus to enter. That's exactly what happens. And so even though we have not figured out who becomes asymptomatic and who gets severe disease, with the comorbidities, they have a very good idea about who has a high probability of getting a more severe COVID than the others.
Thank you, Dr. Joshi. Question to Dr. Shyam. There are reports of thrombocytopenia in patients getting COVID and receiving vaccines. Somebody who has ITP, is it a relative contraindication, or do you have to be cautious to give the vaccine?
Yeah, there was actually a big, howl and cry about that one physician receiving this vaccine dying because of platelet counts going to zero. But again, we don't. It's not very clear what exactly happened in that case, and the scientific community is of the opinion that it's unlikely because of the vaccine, because it's very unlikely that such a drastic thing can happen along immediately after the vaccine, and nobody knew what was the platelet count of this person before the vaccine. It's be under investigation if I'm correct, and we don't really know what happened in that case. But just again, 180 million doses of vaccines are already given till date. No such cases are reported again. So we have to, at least we have to think that this is not related to the vaccine. And as of now, ITP is not a contraindication for vaccination.
And going to wind up. Thank you very much, Dr. Shyam. The last question for Dr. Joshi. How can we test whether the vaccine worked? You took both the vaccines. Is there a test which can basically tell us that you are immune to this? Like measles, mumps, rubella, you can take the white titers. Can we have a test to do that for corona vaccine?
Yeah, it's quite simple. There are two ways to do it. One, you just take a blood draw, right? And then you take your plasma, and then you look for antibodies against the SARS-CoV-2. And if you have a lab like mine, you can also do a virus neutralization assay, where you actually take the live virus and you put dilutions of your plasma samples, and then you see what is the dilution, how low can you go before you do not see virus neutralization. So the short answer to your question is it's a simple ELISA to test and see whether you made a response against the vaccine or not. I got both shots, and I'm going to have my student bleed me so that we can actually run that to see how well I have done over the time.
Is that commercially available?
I'm sure the local labs do that, right? Shyam, do you all do it in the hospitals?
They're not doing it routinely, but they are going to start it as a research trial to see how this is going to last. But I just want to add one point. On January 21st issue of the New England Journal of Medicine, in Moderna actually published a research letter of follow-up of following the antibody levels of after Moderna vaccination trial follow-up, and they say up to 120 days. I mean, till that date, actually they actually plotted the antibody levels and said they have the neutralizing antibody titers till that date. So we have some data. It lasts till that time.
Actually, that neutralization titer was done in the same place that I work at.
Okay.
Yeah, they do. Not me. My colleague. He Dr. Suthar. He does the new titers.
Thank you. Thank you. It was great discussion. Binu, go ahead.
So thank you. I have one more question, Dr. Matthew. I didn't complete that. I just wanted to, thank you for all the speakers, but Dr. Jacob or Dr. Menon, tell, all the young people listening to this, right? There was saying that Pfizer made a lot of money. Oh, Binu, you made money because of a volunteer. I didn't make a single dollar. I said I was not worried about vaccine. I was worried about COVID. But what do you say, doctor? You can comment on that. Tell people what I see right now, and I'm working also is the depression or among young people. That they cannot go to college, they cannot go to school. We are all social people. We cannot mingle. Church are all closed. So depression. Maybe Dr. Menon, you will be treating more depressed patient than So what do you want to tell people, right? As Dr. Jacob said, if you get vaccine tonight, go and take it. That's what I want to say. What do you want to say? I see depression among people.
Of course, I mean, because we are all social beings, and isolation definitely causes. It's going to cause depression, and the best way to go back to normalcy is, achieve herd immunity fast, so that we can go back to your normal life. And the best way to achieve herd immunity without minimal loss or without any loss is vaccines. So get vaccinated, whichever vaccine you have, get vaccinated as fast as possible.
And the thing to remember is this is not forever. It's a short term. And your expectation should be things will get back to normal, most likely end of 2022, right? That's the timeline you're looking at. It's not going to get better. You're not going to Kerala and go sari shopping in this fall. I guarantee you that, right? It's just not happening. And by the time the world gets immunized, and like Dr. Sham said, you build herd immunity, that's going to take time. I will give you one more example. If you look at people over 18 years of age in the US, there are like 240 million people, okay? So if you have to give 2 doses, that's almost 500 doses of vaccine you have to give. If you vaccinate 1 million people a day, it's going to take you more than a year to vaccinate everybody, to give 2 shots. It's very simple. So as long as you're realistic about where things are and how long this is going to take to go, then I think it's okay. If you look back, we have pandemics that lasted hundreds of years, right? The Black Plague lasted 300 years. We got out of it. We will innovate our way out of this. A year or 2 years in an 80-year lifespan is nothing. Take time to stay home, write your movie script, or do whatever it is that you need to do to get through this, and then you'll be fine.
Thank you. I think it was very discussive, very active and participating meeting with the talks in the end. I applaud Dr. Joshi and Dr. Sham and Dr. Soli for being part of the moderating team. At this time, I would like to invite Thomas M. George to present the vote of thanks.
Yeah, go ahead.
Can you hear me?
Yes.
Yeah.
Okay. Good evening, all. It's a great privilege to say a word of thanks to all distinguished guests and all who attended this seminar. First, I would like to take this opportunity to thank Professor Joshi Jacob and Dr. Sham Kumar Menon. On behalf of the ECHO team, I would like to express our sincere gratitude to your very informative speech and sharing a wealth of knowledge and clearing out the myth and misunderstanding about COVID-19 RNA vaccine. Next, I would like to thank the iNani team. Jinsi Chako, Archana Philip, Anna N. George, Solimol Kurula. I would like to thank you all for your help and support and for sharing your experience. As you all know, Binu Kopara, a scientist working with Pfizer, was also actively involved in the COVID vaccine development. Thank you, Binu, for sharing all your experiences. Also like to thank Binu Thomas, Julia Digital, and Raju Pallat Asianet for your help and support. I would also like to thank each and every one of you who attended this meeting. In spite of your busy schedule, you were able to share some time with us. Thank you so much. I think it is quite inappropriate if I don't say a word of thanks to Dr. Thomas Matthew, Executive Director of ECHO. He is very instrumental in spearheading ECHO to be one of the most active and successful humanitarian organization in New York. Thank you, Dr. Matthew. I would also like to thank Mr. Sabu Lucas, Biju Chako, and Binu Kopara, and all other ECHO team for their help and leadership. Thank you very much. Stay safe. Be well. Thank you.
Thank you.
Before finish, I want to say one thing very important. This session will be available in the YouTube with the Julia Digital Creation, and the session will be available with the live broadcast Asianet US weekly round of Facebook also. You can also visit that YouTube and you can see all this event today. Thank you. Dr. Matthew or Biju.
Thank you, iNani, of Dr. Anna George, to be on board on such a short notice. I thank you for taking time to participate actively. We saw a lot of people from iNani also participate in this one. Thank you. I know you had raised your hand. I'm not sure, was that for a question? You want to unmute yourself? Okay.
Hi, everyone. I heard Binu say about depression. during the COVID time. So I just wanted to tell you that INANI is having a panel discussion on March 6th on psychosocial effects of COVID. So I'm inviting all of you to please join us for that panel discussion on March 6th. I'll be sending the flyer to you and then maybe you can share it.
Sure. Thank you. Thank you, Nana.
Okay, thanks.
Thank you. Good night, everyone.
Thank you.
Thank you and good night.
Okay, good night.